Hello to our friends in Gainesville. My name is Philip Rulo with Rolltract, and I wanted to quickly go over a couple of things, including what we covered in the email that I had sent today. First thing, I noticed in an earlier email that somebody said the surgeons didn't like the new post because they sat too low because the collar had been repositioned, and that is partially true. I mean, yes, the collar has been repositioned. As you can see, it's now in the middle of the post, and the reason that it was moved is to allow more travel so we can do different procedures. So it's not actually a stop collar. It was a stop collar back in 1992, but it was moved and it's no longer a stop collar. So what you would do, actually, just to prove the point that it doesn't need to be a stop collar, for over 10 years, this was our bottom post. There was no collar on it at all. So quickly, if you have your clamp, and somebody has said you have mostly second generation clamps, and I agree with that, and the clamp hole is round on the bottom. So you can go ahead and put this clamp on. Try not to take up too much of your time here. Put the clamp on, and then what you would do, obviously, with your older posts is you would just drop them into place and you would have the perfect height, more or less. Actually, I think it's a little too low. But what you were able to do many years ago is put this longer post in, and then what I tell people to do is when you put the post in, put your hand underneath, or have somebody who can put their hand underneath, and as soon as their finger touches that post as it comes through, that's where you tighten it. Then you go ahead and tighten this wing handle, and you can tighten it pretty tight. You don't have to over tighten it, but tighten it pretty tight. And this is not going to go anywhere. So the stop collar is not necessary. So what I would suggest that you do the next time you use a Rolltract post, one of the new posts that has the collar on it, do what I just did, or try to get an idea. If you don't want somebody underneath the table, go ahead and put it in, drop it 3 inches. You can determine 3 inches as you're putting the post in. And maybe just at the height that you feel that you're comfortable. And if you can, have someone under the table with their finger and they'll feel it touch. And then go ahead and tighten that wing handle. And this, again, is not going to go anywhere. It does not need to be lowered all the way to that stop collar. That wouldn't make any sense to have a good portion of the post underneath the table doing nothing. So go ahead and put it in, tighten it, and then put your top post on, and you have more height than you had with the old one, for sure. Just show you quickly, I guess. Very old clamp. May have a couple of these in-house. Clamp was produced when I was still in high school. Look at me, boy. So a very old piece of equipment. You go ahead and drop that in, and you can see right away that the difference in height between the old one, that they're saying they want to have that height that the old one doesn't provide, or the new one doesn't provide. So here's what you used to have. With the lower post with that stop collar, this is your height. With the newer post, if you put it in as I explained, then you're going to have actually almost close to 2 inches of additional height. So again, when you put that in, it doesn't need to go down to the collar. That collar is not, I can't say it's not a stop collar. Sure, it's going to stop the post as it goes through, but it is just designed for allowing the post to have more travel. When we use the retractor for ASD or VSD in pediatric patients, we have a whole different post configuration, and when we do that, we lower it depending on the patient's size. So that's why the collar has been moved. We got a little baby on the table, we need to come way down. So again, that's why the collar was moved. Make sure that you tighten your wing handle adequately. Again, it doesn't need to be over tightened, but it does need to be tight. And then your post is not going to go anywhere. Okay, the second thing that we will cover, if you're still interested, is the difference between the 4100-28C and the 4160 that was asked also in an earlier email. A couple of things, and I'll try to do this as quick as I can. If you purchase this 28C bottom post, you will need to purchase all new clamps as well. You do have clamps at your facility, obviously, but they have a round hole, which we looked at a little bit earlier in the video. So if you have a round hole and you have a square bottom post, it will fit into the clamp, but it is not safe to do that. That is why we make a square base. We make a square base clamp as well. So if you put that post into the square base clamp, it can't rotate. It's a square into a square. It can't move. So the problem is if you try to use your existing round base clamps, I'm not good at editing, or I would edit that out. So you're going to take your, or take this square base bottom, put it into your existing round clamp. And the reason we don't want to do that is if this is not tightened adequately, and during the procedure, the PA bumps this because it sticks out. So if the PA were to bump it, it's going to turn, of course I can't get it to do it. Well, it's going to turn the retractor over the table. Very unsafe. So we don't want to put the square into the round. The square has to go into the square clamp, which you don't have. And then you would need to purchase all new clamps, which you probably don't want to do. So you would need to buy new clamps if you use this. So the option is, of course, the other 4160 this is a post clamp where the post is welded into the clamp. And it still provides the bend to provide a little additional space for the patient. And then you would just purchase this. The problem is this right here costs as much as this. And then you would have to buy the post as well, which then would be an additional expense. If you just go with the 4160s, then you don't need to buy anything additional because it's all here. And it provides just as much height as the 32C that we had looked at earlier. So the options are tell the OR staff to put the 32C in correctly and not all the way down to the collar, and then it will provide adequate height. Then you won't have to make a change. If you decide you want to make the change, then I would suggest going with the 4160 because it's more cost effective. The other thing that was mentioned is some of your clamps are not getting a good purchase on the bed rail. You said you got new beds, and that could be the reason why. That could be the reason why. The other reason is that we made a design change in our clamps. Somebody had said, and I apologize, I can't remember who it was, that you had mostly or all second generation clamps. I'm almost done. That you had all second generation clamps. But our records indicate that you have 2 of the 3rd generation clamps as well. Next time you're in a case and you notice, if you are in the case and you notice that the retractor is moving on the bed rail, look to see if it's one of these generation clamps. We made a design change to this clamp after the initial introduction to it that helps stabilize it. Your clamps don't have that design change, one of them. One of these does not have that update. So that clamp could be the reason the retractor is wobbling. All the other ones may be fine, I'm not sure. But it's a lot of information in one video. I apologize that it took so long. Call me. We can do a Zoom conference if we need to go over this. If you do call me, please text me first at the number below in my signature, and then I will try to get out of wherever I am to answer your phone call. So thanks again for your time. Have a nice day.